One of my best students at NYU committed suicide. One of the most accomplished students in our business department committed suicide. If you looked on paper what you were saying, everything lined up, but the lens that they saw themselves with was blurry. And they were fragmented as people. Now you as a specialist, you run with وَابْتَغُوا مِنْ فَضْلِ اللَّهِ. So I think what you touched, both of you touched on it brilliantly as well, is the lens is disconnected. If the lens is disconnected, I can't see. And so I'm trying to see religion through secularism and through secularism, but I don't have a root in God. And so if I'm not rooted, I can't grow.
So and just to pick up from this, like, this is what I've struggled with is as an imam and as someone in training, getting my hours as a clinician, here's the deal. I will be the first to say to the imam, know where you have to stop at. But hold on though. There's another side of this conversation. I have to say to the clinician too, know where you stop at too. And that's why I think the synthesizing is so important. When your name is, Sheikh, when your name is Muhammad such and such LPC, that young Muslim guy is coming to you because your name is Muhammad. But many times they're coming because they feel safe that you will religiously know them, understand them, and be able to help guide them and help them get closer to what their ideal self is. And as Sheikh is saying, these classical books began by helping us understand who we are. I think it's important also, as I lecture my imam friends that please know your limit, I also lecture my other colleagues to say, hey, maybe we need to get some hours in our Islamic training. Maybe we need to go to Roots and sit with Abdurrahman Murphy a little bit, or we need to go to Suhaib Webb and learn a bit from him so that we gain our grounding in Islamic. Like we're all going for, continued education. But what about our Islamic continued education? Because I think we have an amana, a trust, because once we have access to that heart, and you know how it is, you know when that therapeutic alliance kicks in, that person's heart opens to you.